Assalamualaikum and a very good morning. Hi everyone, I'm Haryana from Research Cluster Office. Thank you for joining today's session. Before we start, just a little housekeeping reminder. For the attendees, please fill in your attendance for our records. And then all the participants have been muted. Please raise the hand icon if you want to speak. The organizer will unmute your mic. You can also type your questions in the chat panel on your right side. Today's session is being recorded. We will share the link with you after the events, and then we welcome you to revisit the contents and share it with your colleague. Thank you, and I'm over to you, Dr. Juan, to start the session. Thank you.
Thank you, Yana, our MC today. A very good morning. My name is Juan, Dr. Juan. I'm acting chair for FNW, Frontier Natural World. And today we are very fortunate to have these what we call public forums. And the title for our talk here is Fighting Dengue, a plan for healthier future in social media. Today we have our three panels. So let me give a bit of a background of this what we call public forum. Okay, this public forum, of course, we are going to share to the public what is the success story and our championing our grant, which is the internal grant, interdisciplinary research program, which is the IIRG grants. These three panels have received in year 2020, and they have managed to complete this project we are flying color. Okay, that means a very good what I call output and also the impact. That's why we invite these three panels or the recipients of this IIRG in 2020. Of course, I think we are no need. We will go in detail what is dengue and how this project benefits the community and the society. I mean, dengue is not very alien to us. But again, we need to know the danger and the severity of this dengue, and it's still here. Okay, how we going to use the latest technology and research to counter this deadly dengue virus? So before we start, let me introduce our panel here. Our panel number one is Associate Professor Dr. Rafza binti Ahmad Zaki, or Prof. Rafza. Hello, Prof. Rafza. Okay, so this is our professor. She is from the Department of Social and Preventive Medicine from a Faculty of Medicines. And the scope of discussion for today is smart help for dengue using artificial intelligence to improve understanding of the disease severity. So let me give a brief introduction of Prof. Rafza. She is the Associate Professor in the Epidemiology at Department of Social and Preventive Medicine, UM. She has received a training in evidence-based medicines from University of Oxford and mathematical modeling of infectious disease in Imperial College London. She received an award by European Society in Clinical Microbiology and Infectious Disease from attachment at the European Centre for Disease and Control in Sweden. Recently, she has selected as a faculty scholar for the Malaysian Implementation Science Training Program and intended training in implementation science at Yale University under the NIH fund. She has led multiple research grants, including the International Collaboration Project funded by Swedish Research Link Grant for establishment's early warning system for dengue in Malaysia, in collaboration with Umeå University, Sweden. She also received the very prestigious Newton Fund for the Big Data Research and Dengue collaboration with Faculty of Computer Science and Technology in UM. Also working closely with University of Nottingham, UK. She is also head for the Educate, Monitor, and also predict outcome with the research in dengue empower program and lead the sub-program on improving dengue severity using artificial intelligence study. So this is a very brief introduction of Prof. Rafza. So I move to our next panel. Our next panel is Dr. Teo Ching Hai. Hello, Dr. Teo. Okay, so let me brief a bit about Dr. Teo. Dr. Teo is senior lecturer at Department of Primary Care Medicine and the E-Health Unit in Faculty of Medicine in UM. He led the mobile health and telehealth section of the e-health unit. He teach digital health online, research in various workshop, lectures, and online courses. He conducted digital health and e-learning related projects as COVID-19 symptom monitoring system, electronic medical record-based decision support for low back pain, consultations for patients with type 2 diabetes, very important, prostate cancer training program, and also decision aid. And he also lead a project entitled Advancing Co-Creation of RLO to Digitize Healthcare Curriculum, producing 23 reusable learning objects with open access, multimedia-based and interactive e-learning resource. And he employs a concept of gamification to improve learning on dengue for the public. This is about Dr. Teo. Hello, thank you. Then we move to our third panel, Dr. Ng Wei Lik. Hi, Dr. Ng. Okay. So Dr. Ng is a senior lecturer and primary care physician at the Department of Primary Care Medicines in Universiti Malaya. They have involved in several e-health and e-learning projects, including My VIP at which the synonym for virtual patient for medical education, PCAT, prostate cancer screening training module for general practitioner, and COVID-19 symptom monitoring systems, dengue self-monitoring systems, okay, in the current what we call a self-monitoring system for dengue. He explored the self-care practice and outpatient management for dengue patient with the idea to utilization the digital healthcare for self-monitoring of dengue at home to prevent delay in the treatment. So this is a brief breakdown of our prestigious and well-known panel today. So let us start this what we call this forum. I think again I mentioned that dengue is not foreign to us, but it has been in our society for a very long time, right? And of course we have tried different way to reduce or eliminate dengue, but we still at this moment be unable to do that. Okay. So this is the one of the platforms where we can discuss how we can further reduce or hopefully we can eliminate this dengue from our society, because of course the dengue may cause some people to fall sick, right? Fever, dengue fever by call. But if a very severe conditions, it also can cause death. So this is the questions or forum that we need to discuss in detail. How this smart help for dengue using the artificial intelligence to improve the understanding and prevention of this what we call dengue disease. So I will start with questions in our panel number 1, which is the Prof. Raza. Okay, Prof. Raza. Okay, so I want to ask you a very simple question first, okay. So what is the dengue and how severe is dengue? Of course, you can talk about in Malaysia context, right? I mean, any statistic that at this moment, right? Of course, the Malaysian governments have put a lot of efforts, okay, and also a huge budget to counter the dengue. What is the current situation of dengue in Malaysia? Thank you. I pass to Prof. Rafsa.
Okay, thank you, Dr. Juan, for the question. So, I mean, to answer your question, because I did actually put some of the information in the slide, but as we know that dengue has been always a problem in Malaysia. If you look at the trend of dengue over the past 20 years, the trend is increasing, and in fact, we know that the only time that we see the reduction in number of dengue when we have the COVID-19 period in 2020 and 2021. But 2022, you can see that the number of dengue cases is like bouncing back. So means like we are almost going back to the pre-COVID era of dengue. So means that we are not really tackling the dengue. If you look at the statistic, we say that 2020 and 2021, the number is going down. So it's actually not reflecting the true picture. So we are now going back to the where we seeing a problem with dengue cases. And like you also mentioned that the main problem with dengue is actually the mortality. Yeah? Of course, when we say that most of the cases are mild and no symptom, but when you have high number of cases, like in the past, you know, the highest cases we can reach up to like more than 100,000, 120,000 of cases per year. So with that high number of cases, you will see significant number of severe dengue cases with a high number of deaths. So if we don't tackle the problem, then it will be a burden to us. So when we talk about prevention, it should be at many stage before, when you starting from your healthy, before you go to develop a disease, and then once you have the disease, how you can protect them from becoming a severe disease. And if the person tend to develop a severe disease, where can you detect them early so that you can prevent death outcome among the patient.
Sorry. Sorry. So I believe you have some PowerPoint to share with us, Prof. Rosa.
Yes,
Can
yeah.
you start with your presentations?
All right,
Thank you.
sure.
We can see your slide based on
Yeah.
your explanation just now. It's a very serious issue about this dengue
Yeah.
virus. So
Try
you
to
may start when
select.
you're ready.
Yeah, just try to do it in. Okay. Can you see it's in the presentation mode?
Yes, it's in the presentation mode, Prof. So you
All
can
right.
start
Okay
when you're
then.
ready.
Okay. Thank you. Okay. Assalamualaikum and good morning. Okay. Thank you, Prof. John, for the introduction earlier on about the project and all the speakers, and thank you all for also joining us today. So this morning I will talk about smart health for dengue. So how using artificial intelligence to improve understanding of dengue or disease severity. So before I proceed, I would like to acknowledge our project, educate, monitor and predict outcomes with research in dengue or empowered project, which is funded by the IIRG grant. So just a quick intro to the project. This empowered project actually aims to use technology to improve healthcare in the context of dengue management, from educating the public, timely monitoring of patient and predicting the health outcome of hospitalized dengue patient. And this project actually consists of members from various disciplines and faculties, and divided into three sub-program. The first one is dengue self-care or DESCA. Next is dengue self-monitoring system or DESMOS. And the third one is dengue severity prognostication or DESPROC. So in my presentation, I will focus more on the DESPROC project. Later, we'll hear more from the other two speakers on DESCA and DESMOS. So why the focus is on dengue? So earlier on, we mentioned about how bad or big the burden of the dengue is. Yeah, if you look at the statistic, the global incidence of dengue has grown dramatically, with about half of the world population is actually at risk. Yeah, it's not only Malaysian problem, it's not only Asian, but it's half of the world population at risk. And the World Health Organization estimated about 100 to 400 million infection occur every year, and 70% of the actual burden is actually occurring in Asian region. Okay, and in Malaysia, dengue is endemic, with period of hyperendemicity, which means that we will always have dengue all over the year, but there are certain year that we will have much higher number of cases. You can see the pattern is like a cyclic pattern. So this poses a significant burden on healthcare resources during each epidemic phase. Okay, and this is the trend of dengue cases in Malaysia for the past 20 years. So you see that the trend is actually increased, except when the COVID-19 hit us in 2020. But as I mentioned before, once we almost going back to our normal routine, so the cases start to bounce back. So we see like the increased number of cases in the year of 2022. And although over 80% of dengue cases are generally very mild and do not have symptoms, the failure to detect dengue cases at the early phase and failure to detect the potential sign of deterioration may lead to an increase in dengue deaths. Okay, so let's recap back on the sign and symptom of dengue, because it's been like few years we've been always overwhelmed with the information on COVID. So let's go back, recap back on what happened when you have dengue. So when you should suspect dengue when you have a high fever, and if you accompanied by any of the two following symptoms, either you have a severe headache, pain behind your eyes, muscle and joint pain, nausea, vomiting, swollen glands and rashes. So these are the sign and symptom of dengue. And when we talk about hospitalized patient, about 4 to 6% of hospitalized dengue patient develop severe dengue. So although this number or percentage might seem small, 4 to 6%, but if you compare to the high number of cases, more than 100,000 of cases per year, and also there's an increasing trend in the number of cases, this actually reflect back in terms of number of patients that requiring hospitalization. So the number of those will require hospital also will be increased, and the number of those will develop severe dengue also will increase. Actually, when you look at the clinical course of dengue or the pattern of how the dengue is, the critical phase for dengue normally develops between 3 to 7 days after you develop the symptom. And warning signs of severe dengue are usually seen between 24 to 48 hours after your fever goes away. So this is the danger part, because most people think, oh, I already, my temperatures go down, I feel better. And then you think that you're okay. But actually, even when your fever is going down, you must still be extra cautious because you need to look for warning sign, because this is where the critical phase is. Warning sign. So warning sign of severe dengue include abdominal pain, frequent vomiting, blood in your stool, nose or gum bleeding, and extreme tiredness or restlessness. So this is the sign that you need to look for, even though you think that you are actually getting better when the fever goes down. So severe dengue is the life-threatening worsening of dengue symptom. There are actually many factors contribute to the development of severe dengue. It can be due to viral factors, it can be due to immunity factors, the patient factors, and also due to clinical management, which include the timing of the patient seeking healthcare and the quality of care they receive. So this complexity of the clinical profile and the overlapping levels of factors makes the structure of clinical data complex and difficult for clinicians to predict severe dengue. So this is where when we can apply this AI technology, the use of machine learning as a tool to identify the possible characteristic of severe dengue is a potential solution, and then can be used to predict severity in dengue patient. So machine learning algorithm will find a natural patterns in data that generate insight to make better decision in selecting the predictors and also make a better prediction. So what my team did, we developed a system with a risk calculator that can be used to predict severe dengue among hospitalized adult dengue patient. So this project involved 3 main phases. Phase 1 is the development and validation of a machine learning based risk scores for severe dengue prediction. Phase 2 is the development of the dengue severity prognostication tool, and phase 3 is the pilot testing of dengue severity prognostication tool in clinical setting. So in phase 1, we gather information on risk factors for severe dengue from a systematic review and also from the clinical experts. Then we develop a prediction model using a machine learning algorithm. So what we did, we utilized historical data of laboratory confirmed dengue cases from UMMC to develop the initial model. Then we used 3 machine learning algorithm, logistic regression model, random forest model, and one class support vector machine model. And this we run all these different type of model and also different timing of this when they come with the symptom. So this algorithm provide a calculation probability method or function that map the predictor's value to a corresponding probability between 0 and 1. So in the end, the logistic regression model derived using data from patient presented on day 1 to day 4 was selected for the final model derivation because it yielded at the best accuracy at that time at 74%. So that was our baseline model. Then in the phase 2, we developed the desktop prototype system, which consists of dengue electronic clocking form, severe dengue prediction, and a dashboard to display dengue statistic. And this whole system also served as the dengue database at UMMC. So this is the Eclacking form, which consists of admission clocking form, a daily review form, and a discharge form. So instead of manual writing or entering separately of detail of dengue cases, the clinician now have one specific clocking form for dengue, which is easy for them to use. Then based on all this clinical information entered into the system, into the Eclacking form, so the system can estimate the probability of progression to severe dengue or whether the patient can actually more likely to progress to a non-severe dengue. And then we have a dashboard to display the patient health summaries and the trend of the clinical variables during their admission. And then in phase 3, we test the system in the clinical setting. So the clinician actually enter the data into the Eclacking form. So as the prospective data continue to be collected and enter using the Eclacking form, the system will automatically predict the probability of developing severe dengue or the probability of non-severe dengue among the patients. So it depends on their characteristics. So for example, in this patient, we have after having the data entered, the probability of this patient to develop severe dengue is 62%. And then the next patient here, after we enter the data, the system predict that the probability of this patient to become non-severe dengue is 71%. So this information actually will be actually useful to clinician on deciding how to manage the patient. So how the prediction system? So what we did after we collect, after the clinician use the system, we have a new data set. So the predicted outcome produced by the system compared with the actual outcome diagnosed by the infectious disease specialist. So we use we have several cut-off point of probability. So just to show an example here, when we use the probability of more or equal to 50% as probability to develop severe dengue, so the diagnostic accuracy of the prediction system is about 84% and can be up to 88%. And the sensitivity of the model is only 60% with a specificity of 85%. So this means that the system able to detect about 85% of non-severe dengue cases and only able to detect about 60% of severe dengue cases. This low sensitivity is mainly because we did not have enough data for severe dengue due to not many severe dengue cases that we have during the COVID-19 period. And some more that during that time UMMC was COVID-19 designated hospital, so we did not actually admit dengue at that certain particular time. So however, if you look at the high diagnostic accuracy and high specificity suggested that the potential of the system able to differentiate those with lower risk of developing severe dengue. And if we look at the negative predictive values, is also quite good, about 98% and can be up to 99%. So means that if the system predict that a patient as a non-severe dengue, the probability that it is going to be true, or the probability that the patient is actually not going to have severe dengue, is about 98%, which is quite a good number. So in summary, the application of artificial intelligence or machine learning in the system resulted in automated prediction and early identification of patient at risk of severe dengue, thus will result in better management. So the system also improved the data collection for the inpatient dengue database at the hospital. And furthermore, it serves as a dengue database, and the system can further be improved with more data for a much higher accuracy and sensitivity prediction model. And when more data is entered into the system, and a much better prediction model will be produced by the system. So in the end, we hope we can improve the prediction, and we can improve the outcome of dengue patient in general, and reduce the morbidity and mortality due to severe dengue. So that's all from me. So maybe we can hear from other panels, and we can have a Q&A later on. Okay, over back to you, Dr. Prof. Joan. Thank you.
Thank you, Prof. Azhar. Really enlightening what we call about this dengue and your technology, right? At least can detect the severity of this dengue in the early stage. So save your questions. You may type your question in the chat box, right? So, or you save your question, you want to unmute and ask later. So let's us move to our next, what we call speaker, Dr. Teo, right? Dr. Teo. Hi, yeah, Dr. Teo, I believe you also have prepared some information on the what we call this technology, right, to counter the dengue. Okay, I see that your scope of discussion in the game changer of the dengue knowledge. Okay, so may you share your slide? You may start when you are ready, Dr. Teo.
Okay, thanks so much, Prof. Zhang, and thanks for the cluster to invite us to share our project lah. Okay, so let me share my screen. Okay, are you looking at it? Yes,
no more. Okay. Yes.
Okay. Okay. So thanks, Prof. Raza, for setting the scene for me and relate later. So as Prof. Raza has described to everyone, it's teamwork. Everyone need to work together. It takes a concerted effort for everyone to work together to really eradicate dengue. As you can see, it's still here with us even now, since how many 10, 20 years, 30 years ago. Okay, so just now, Prof. Raza shared with everyone about her project that is actually helping patients who are warded inside the hospital. So if you are in the hospital, Prof. Raza's project will help the doctor to manage you properly so you are safe. Okay, because her AI now can predict better who will get dengue berdarah or who will not get dengue berdarah. Okay, so that is her scope in the ward. Okay, so my part, actually, I'm tackling healthy people outside. I think people like me, you, and everyone here lah, who haven't got dengue or even who have already have dengue. This thing or game or quiz that we are developing will help to benefit all of you lah. Okay, so just a quick introduction about why we are doing this. As I think Prof. Raza has mentioned to everyone just now, okay, early detection is very important so that you don't come in late, and when you come in late, your symptoms semua is already very severe or very serious. Then it's very hard to save, okay? So not just about detection lah, okay? When you are at home, just now Prof. Raza take care of people in hospital, right? Now, when you are at home, some of you come to the clinic, doctor say you can balik lah, okay? Just take care of yourself at home. But most of the time, people do not know what's the appropriate self-care that you need to do at home lah, to reduce your chance of getting dengue berdarah or even up to preventing death. Okay, so a lot of the time, patient or people like me and you do not seek medical attention in a timely manner. Okay, and then sometimes you do not perform enough or appropriate self-care at home, and a lot of reasons to that. A lot of the time maybe because we do not know enough. about dengue, what we need to do about it, poor knowledge. Yeah, sometimes some people rely too much on certain traditional medicine and they neglect proper medical care. Okay, some people think, ayah, tak apalah, dengue, ringan-ringan saja, tak ada apa punya lah. Low risk perception, you don't think that dengue will cause death and so on lah. Okay, there are a lot of reasons, but in this project, we are tackling knowledge, okay, to make sure people know what to do when you have dengue. Okay, so as you can see, I think Prof. John said game. Okay, so we use an element of gamification. Like it's not entirely a game. We use the concept of gamification to memperkasa, to empower all of you to avoid dengue misinformation and make sure that you perform appropriate self-care when you are at home. And of course, we guide you to seek help in a timely manner lah. Okay, so we develop a quiz-based gamified learning module to challenge people's knowledge on dengue. Okay, so what we actually want to trigger people is actually this. How much do you actually know about dengue? So one day if you have dengue, how ready are you to deal with it? You think you know, but sometimes you may not know the truth of certain things. Okay, so just a question for everyone. Maybe I'll ask Prof. Juan, what will you do if you had dengue, Prof. Juan?
Yeah,
You have
dengue,
fever,
right?
you have fever.
Yeah,
Fever,
fever.
fever.
Normally, I go to the clinic. They ask me to drink more water, warm water. Right.
Okay,
Okay.
okay.
My previous experience. Okay. Some of my family member they have this dengue, severe dengue. Lah, okay, high fever. They tend to have mentioned there's no traditional way or what they used to drink the papaya leaf.
Okay. All right. I will share
They say
with
the
you.
papaya leaf help it and boost the immune system, blah blah blah. At the end, have to go to hospital also, right? I say, why you
Okay.
drink? Yeah, so
But
maybe
can
can
I
give
ask
a
you
bit.
again?
Yeah.
When you got the fever, right? When do you decide you have to go to see the doctor? When? Is it one day later ke terus? Or 3 days later ke? If tak baik ke?
My
When do
one,
you see the doctor?
yeah, my way of my way lah, right? If a high fever means is like
High fever lah. Okay,
high fever,
okay.
I have to go to doctor, right? Because I'm not
Yes,
sure it's
yes.
deep dengue or what. So far,
Oh,
touch
true,
wood, I
true.
did have dengue, but high fever, normally I go to the doctor and
I
take some
see. High
medicine,
fever lah.
Panadol, those kind of things,
Yes, yes.
right?
And then the question, yeah, you are right. And then the question come in, it's about how do you make decision to go when and then how. So in our this game lah, this quiz that Prof. Zhang mentioned the game, we hope to teach people about this lah. When you decide how to go, when to go. Okay, just for example, this is one question that we posted lah. It's a quiz, you see. So for dengue, it's one of the thing that we want people to be alert on is when there are cases around your neighborhood. Okay, even minimal fever, things like that, you need to be really careful lah. Okay, that's one of the big clue lah. If got report hotspot, got other cases in your neighborhood, or you happen to pass by certain places, you need to be careful. And of course, I think the other thing is the experience of warning sign. Prof. Raza shared with you just now. Pain behind the eye lah, joint pain. If you got rashes, those are the sign of dengue. So if you got those, you need to seek help immediately. Okay. So another thing, I think soalan bocor lah. I was about to ask you this but Prof. Raza gave you the answer already just now. So in dengue, very different. When your fever is disappearing, wow, semakin happy, semakin sihat already.
Yes.
It's better, right? But
Yeah.
in the matter of fact, in dengue, no, you are getting into the critical phase. Okay, if you're getting better, your fever getting less, oh, now less fever. In a matter of fact, your platelet may drop at that time. Your hematocrit may increase. Okay, so semakin you feel semakin happy, 3 or 4 days later, you need to be more careful in dengue. Oh, so a lot of people don't know this. When your fever disappear, it's actually danger phase. You need to be careful. So this is one of the things also we want to teach people in this module. Okay, so I think Prof. Juan mentioned papaya leaf and so on. A lot of other things also. People drink guava juice lah, alkaline water, crab soup, a lot of other things also. But then we also want to educate people lah. There has been no evidence that this can cure dengue. Okay, But if you ask the doctor will say, okay, go ahead and drink because it increase your fluid intake. You won't get dehydration. But then don't not coming back to doctor because of you are drinking papaya leaf, you don't come back to everyday follow up. Okay, you need to come back still lah. Okay, those that I show here still no evidence that it can cure dengue lah. Okay, so another thing that we ask, what medicine can cure dengue? Okay, what do you think? Antibiotic, paracetamol, Panadol, vitamin C? Yeah,
None,
no,
none,
none. Oh, Prof. John,
yeah.
you are
Yeah.
absolutely right. Actually, there's no treatment for dengue. That's why we want everyone to come back every day to monitor your platelet, your blood, and so on lah. You can take paracetamol, but it just reduce your symptom lah. It doesn't kill the virus. So this is one of the thing, another thing that we want to teach the people lah. Okay, so no cure for dengue, right? Why can't I just stay home, right? No cure, what? But it's not right because we want to monitor your blood. Because when the blood goes down, we really need to ward you and we need to monitor you properly. And that goes to Prof. Razak's system. Okay. And then another thing that we asked in the module, when you get infected with dengue, kan, you could build the antibody already, right? Next time, no problem lah. Okay. But actually, that is wrong thinking lah. Okay. Wrong thinking. Because dengue, there are 4 types of dengue virus. If you kena the first one, you may get the second type and the third type and the fourth type. If you kena those other type, you might be even worse, you see, because of the antibody interact with the virus and makes you more susceptible to severe dengue. So another thing that we want to educate the people lah, you see. Okay, enough of the teaser. You guys will learn more about it in the module itself lah. I just show you 4 or 5 questions, but in the game, you will learn more. Okay, so do you guys know what is this?
Yeah.
Yes, right. It's a game called Candy Crush lah. Okay.
Yep.
So why I raise this is because we use the element of gamification, just like Candy Crush lah. It's very addictive. Ketagih, play this. Every day I want to play, I cannot stop myself. Why? Because they put in some gamification element that tag along with human behavior. It will make you ketagih one. Okay. One of a few things that in the gamification element are badges. They give you star, how good you are doing, and then you can level up. You have leaderboard. I want to be better than my friend. I want to be in front. Yeah, I want to chase. You have progress bar. If you don't complete, you feel like itchy. Itchy. I want to make 100%. Then sometimes got currency. Sometimes they give you award. They give you challenge between user. So in our module, the dengue that we have developed, we follow very much this app called Duolingo. It's actually an app to learn about second language. If you want to learn other language, I suggest you to try this app lah, Duolingo. Japanese ke, Mandarin ke, okay, it's quite fun and gamified. So you get a bit of addicted to it also to learn. Okay, so this is how our app look like lah. Okay, Dr. Ng later will show you more. This is a simplified version just about the gamified quiz section lah. Okay, this part you see there's a trophy. We have 7 modules. There are only 50 questions for you to learn lah. Questions that we posted just now. Just now I show you 5. There are 45 more things that you need to learn about dengue. So we also make this dengue essential. No matter how busy you are, there are 15 questions here. We hope that you will learn it lah. If you cannot finish 50, we hope you learn the basic essential knowledge about dengue here lah. Okay, so I think I showed you just now lah how it works inside the system. Quiz based, but we also give you medal and progress bar so that you finish the module. Okay, I think got some award, some fireworks, some animation also lah throughout the app. Okay, so we are now evaluating it, doing some trial, online trial. And after we have done that, we hope to really disseminate it to everyone. Facebook, through mass media, we'll publish it in the newspaper. We also hope to encourage school, NGO, and anybody's lah, any companies lah, who want to use the app to use it lah, to learn about dengue as much as possible. MOH as well. Okay, so one of the way that we are unable to offer reward in this app because limited grant, but if it's taken up by company, NGO, and so on, the company can offer us a minimal award lah, and make it a competition so that people reach 100% to learn about all this dengue. I hope the things that I showed to you just now, the common myth, will trigger you to learn about the other topics in the app lah. Okay. Again, I think Prof. Razak mentioned is IIRG. We really thank the funder, for this to enable us to do this project lah. Okay, thanks so much. Over to you, Prof.
Yeah, thank you, Dr. Teo, for developing these gamifications. So hopefully this will reduce, okay, or tackle the those are very in a critical situation, right? After understanding the danger of this dengue, even myself, right, sitting in I will use this, right? My knowledge on this dengue also limited. So later I will try to download these apps, right, and play with these gamifications. Hopefully that we can next time also have a sponsor from our maybe our big company, right? Maybe a voucher, something like that, right? Okay.
Thanks.
Okay. Thank you very much. Those are listener or participants here. Maybe you have any, you can get any sponsor here. You can contact Dr. Teo, right? We welcome any what we call collaborations with the universities. So let's us move to our next speaker. Okay.
Hi, Dr. John. Thanks.
Hello.
I'll take
So
over.
Dr. Ng. So
Hi,
Dr.
Dr. John.
I
Yes.
believe you also have the what we call PowerPoint, right? That you want to share with us.
Yes, sure. Okay.
So
Just
I
give
can
me a
see that.
moment.
Yep. So Dr. Ng will have this scope of discussion on the smarter dengue care, right? Using technology to monitor how sick you are, right? Okay. You can start when you're ready.
Okay. So hi, good morning. I'm Wei Lik. I'm a family doctor, and I'm also a lecturer at the primary care medicine department. So today I'll be sharing the last component of our project, which is on dengue self-monitoring system. So in short, we call it as DESMOS. Okay. So basically, in our research, we are trying to explore the concept of using a mobile app to monitor the diseases. Okay, so most of us will be familiar with MySejahtera, okay, particularly during this COVID-19 pandemic. So you know that if we turn out positive for COVID-19, probably most of us here were at some point of time. So we would be subjected to a self-isolation, we'll be in quarantine, and every day we will receive a notification from our handphones to answer a series of questions, right? How are you? Are you having this? Are you having that? Okay, to see if we are doing well at home. So if we're not, then probably we'll receive a notification asking us to go to the nearest clinic and hospitals and to be accessed by a doctor. So similarly, we are exploring the same concept here of self-monitoring for other diseases to see if it really works. And in this case, we are focusing on dengue fever. Then we ask, why do I need a mobile app for dengue fever, right? So to answer that questions, I think we need to visit back that how do we manage dengue at this moment? So Prof. Razak has already shared with us the statistic, right? Up to 80% of the dengue cases are mild and self-limiting. Okay, so while we are under the impression that most patients would likely be admitted, the truth is most patients with dengue would still receive only outpatient follow-up, okay, which is the mainstay of dengue care, where in Malaysia, usually we will ask dengue patients to come either daily or at least at a regular interval to come to the clinic so that doctor can access you. We need to take your blood, ask your symptoms, examine you to make sure that you're still doing okay. Okay. And Chin Hai and Prof. Razak has already shown this chart before as well. The question is why do we need a daily follow-up for dengue? Okay, in our first phase of our studies, we have interviewed some dengue patients, and we have patients telling us that it's such a hassle to come daily to the clinic, right? You need to poke my arm daily for the blood, and not to mention the everlasting waiting time in the clinics. Okay, So the reason for that is, as mentioned, that because we are worried about the critical phase or the danger phase of dengue, okay, which may coincide with the resolution of fever. So again, you think you're getting well, but the opposite may be true. Okay. So while doctors will be monitoring you and examining you for warning symptoms during the clinic visit, okay, we probably only see you for 10 to 15 minutes or probably even 30 minutes, depending on who you see and how's the workload in that clinic. So out of 24 hours in a day, we probably covered even less than 1 hour of your 24 hours in that sense. And for the rest of the day, most of the time you will be at home, and probably some will be still at work, and that is beyond the scope of medical care. Right. So this is where sometimes patients can develop these danger symptoms, these warning symptoms at home. And this is where we are trying to see if our application would be able to help in some way or another. So well, key points here, yeah, to look for dengue sign, warning signs of dengue. Right. So hence it's important for us to take good care of that at home, right? Chin Hai has already shared. Self-care practice is one of the important things we need to look at. Okay, so are you drinking enough? Okay, are you aware that you are actually having a warning symptoms when you're at home? Is there anything that you should avoid doing when you're at home? Okay, and also of course a timely health-seeking behavior, right? Do you seek medical attention immediately? In Chin Hai's case, he's asking Dr. John about the fever, right? But in this case, doctor has already told you are likely or you are confirmed to have dengue fever, and you develop a new symptoms, which sounds like warning symptoms. Okay, would you actually adopt a wait and see approach? Yeah, I have an appointment the next morning. Probably I should just wait until the appointment next morning, or should I go now? You know, I already had that symptom to begin with. All right. So timely health seeking is also one of the key factors to effective outpatient management in that sense. So as mentioned before, we did a qualitative interview among our patients and also doctors actually. So some of our findings in relevance to our talk today is we still find patients' understanding of dengue warning signs were still lacking. Okay, there are many studies that have already shown this, and consistently we find the same thing as well. You know, despite all the education efforts that has been put up, all right, and patients still delay seeking help immediately, even though they have developed some form of warning symptoms. But there can be many reasons for it. Chin Hai has mentioned some of it. Well, of course, there's also things like personal circumstances. You have to take care of your child at home. There's no one else to take care of your child at home. Okay, it's a weekend and some clinics are not open on a weekend, not keen to go to hospitals, you know. All these circumstantial factors may be a reason for patients not going despite developing some form of warning symptoms there. Okay. So that's why we are asking ourselves, can our dengue self-monitoring system helps in reducing this treatment delay among these outpatient dengue patients, right? So Chin Hai has shown the interface, and if you're sharp enough, you may notice there's actually slight difference in the interface that you saw here, because in our side, we actually had an additional component of symptom monitoring. Okay, so at this moment, we are still testing the app, so it is not accessible to public yet. We only open up the education component to it. Okay, so it's not much difference from a MySejahtera app where you monitor your symptoms for COVID, just that the type of questions that we ask here may be different, catered towards the dengue fever. And of course, you also receive a prompt up notification depending on what you key in. So whether it's advised to seek immediate care or you can still stay at home. Okay. So I would like to stress here that we are not actually looking to replace the usual standard care for dengue. I mean, you still need to come for your regular daily follow-up in your outpatient clinics. So what we are looking at is whether we can complement that usual care for the many hours that the patient spend at home. Okay. Then of course we also include some of the concise self-care information so that patient can have a look. And what are the recommended best practice for the self-care at the moment. Okay, so we have gotten some feedback from our users. We are still collecting the feedbacks. But so far it has been quite positive, and we are quite encouraged by it. So these are some what did some of our users have to say. So they define it as a very simple, clear, and easy app to use. Okay, they think it will be useful for their monitoring, even if they are admitted and they are discharged from the hospital for dengue, and they still find this may be a tool for them to use. And there's one patient that reflect back on his previous dengue experience and said, "Oh, if I have used this app at that moment, actually I probably would have sought help earlier." Right? This is exactly what we are trying to look at and to prove. But we're still running our trial at the moment, and we'll be interested to see how it turned out in the end. Okay, and when we talk about dengue education, this is talking about Chinhai's component on DESCA. So we are seeing a dual benefit here, education and monitoring at the same time. Okay, so you have patients saying that not only you can monitor, but you can increase your knowledge. And what's encouraging is that they find the content is more useful, much more effective than advertisement and televisions. They find that it improve and deepen their knowledge. So the content of the knowledge that we are sharing in this DESCA Desmos component hopefully will be something different that we are offering here. Okay. So what will be our future plan? Of course, it will be ideal if we have more fundings to do a full-scale trial to see how effective is it. Is it useful in the first place before we jump into implementing this in the actual practice? Okay, and we have heard that there may be plans for my Sujatra to roll out a dengue monitoring. It will be interesting, and we'll be very happy to share our findings if that were to happen. Okay, so that will be part of our dissemination of findings to the stakeholders in that sense. Okay, and I think with that, that's all I have to say regarding our project. So thank you. Okay. Back to you, Dr. Chuan.
Thank you, Dr. Ng. This is a very interesting topic. We are using this AI and gamification to what we call have an early detection and understanding of this dengue fever. So now we open for this forum for discussions. Actually, I already received a lot of these questions. So that we can start this forum. Before I start, maybe I ask a bit for myself because I quite interested on this topic myself. Because one of my what we call childhood friends passed away because of the dengue. So it's a serious matter to me. So what I want to know is what is the currently you have this right called AI gamifications for this what we call dengue. I believe by implementing this will be beneficial to at least reduce the mortality of this dengue. I mean the death right caused by this dengue. I can see from the statistics, right? Every year, a few hundreds, okay, at least 200, 300, sometimes 90 or 70 people pass away due to dengue. Okay, look at the statistics, maybe it's low, but if it happened to you or your family member, right, then you will feel the pain, right? So it's a very serious matter. Every life is very important. So what is the key challenge, right, that you think, right, key challenge for these apps or these AI to be implemented? A challenge means can it have it faster? I mean, can it have it tomorrow? Of course, tomorrow not. Maybe faster in 1 month's time. We can have this. What is the challenge now? Okay, to make it available to public and so on. What's the main key challenge of this AI and also the gamifications of these projects to be implemented nationwide, at least in Malaysia first and global in the future? I pass to Prof.
Okay, maybe I can answer for my part first. As you know that my system is actually targeting the inpatient dengue in hospital. So when we talk about implementing that system in the real setting, one of the greatest challenge is actually how we want to integrate the system with the current hospital system, because we know that most of hospitals, they have their own internal system which some of the hospital already have the electronic system, but some of the components still require a manual hand written been applied. So the difficulties is actually to integrate. So that's why I think what our project, at least we have received good support from our team, from the UMC partners in the infectious disease team. So because they see how important is we have this system in. So but if we be able to show to others that this system can work in PPUM or UMC, so means that this can be applied in other hospital settings. So that's the challenge of integrating to the hospital. And then the next challenge is to sustain, and then how to you can improve that system. Of course, you want it to be better, the system you want it better. So that's why we require probably further funding support until we establish a much better system. Like for my project, our aim is to come up with a system that they can have automated model development, because when we have a automated database entry, you will have automated development of a model, then the system can actually improve the model over time itself. So this is actually our future plan to expand this project.
Anyone, Dr. Teo and Dr. Ng, maybe you want to give some detail of your gamification and LI. That was the challenge.
Yeah.
Anyway,
Chin, you go first, perhaps.
Okay, just a quick one. For me, it's teaching something people don't think it's important to know yet. Okay, so a lot of the times people don't care to know until you get the disease. So we have to really design so that it's simple, it's short. I think in our module there are just 50 questions lah. Okay, it may take about 1 to 2 hours at most lah. We don't want to make it too long, so then people feel like bored, they don't want to do anymore. And then something to trigger them to download the app is important, because another dengue thing, not interested. So that's my challenge. I need to do something so that they go and download the app. That's why I think I raised some challenging fact just now, so that people, okay, I need to really learn it, that kind of feeling. So that's my, if they got in the app, I think they should be okay to proceed until the end using the gamification approach we have.
Yeah. So you may say that you will die from dengue. Then maybe they will.
Yes. But yeah.
Yeah, but it's true fact though. Yeah. Okay. Dr. Ng.
Yes. So for me, because we are actually evaluating a more self-monitoring system at home. So I think one of the biggest challenge and one of the biggest concern that we have is of course the patient safety. Okay, which is of course of the most importance here, because sometimes it's very difficult, right, to really predict the human behavior, how they react to our set of questions and how they react to our advice, and or whether patients is thinking this is actually a substitute to our usual care, which and over time and over again we trying to emphasize this is not the case. Okay, which is why we are still not opening up this to public yet, because we are still testing the concept. We want to have a proof of concept at this point. And of course, when we talk about questions in our algorithm, right, how best do this question can replicate a real life consultations by doctors? Okay, because after all, these are very rigid questions. Different people may interpret the same question in a different way, and what they answer is a very rigid yes no kind of questions, right? And how best can we simulate a real life consultation? At this point, we are still exploring it, whether in future artificial intelligence is a way to go. That's something to consider as well. Yeah, I think that's all.
Thank you, Dr. Ng. So we have some question from our participants here. From Adina binti Abdullah. Salam Prof. Rafza, could you predict the model be extended to dengue patient presenting to primary care? First question, how much data do you need to retrain the models? So, Prof, I pass to you.
Okay, Thank you. I think it's Praharina from VCM. Thank you for the question. Actually, our model developed specifically for inpatient dengue. So means that our current model cannot be used for other setting. However, the same method or same technology can be applied to the outpatient, but you have to develop another set of model using outpatient patient and what is the outcome, which is admission as the outcome. So the same method can be applied, but our model is only specific for inpatient dengue and predicting severe dengue only. And then the next question, how much data needed? Okay, the more data is the better, of course. Even like currently, I mean, when we develop initial data, we only got 400 data, and then
400.
that is considered as still a small number as well. I mean, the more number is the better.
Okay, so now we have 54 participants. Those are not haven't registered, please register, right, for our records. It's a very good response. 54 participants, very, very good response. And now already 11. Okay, because these very interesting topics, I will extend another 10 minutes for this discussion. Hopefully, all the participants did not mind, right? We extend another time because this is a very important topic as well. Okay, live for that. Oh, sorry, 11:30. Okay, I thought 11. Now 11:30. Okay, sorry. So we have still a lot of ample of time, another 30 minutes. So we go past to another question here. Nori from Nori Hiraharaya. Prof. Rafza, thanks for your great presentation. I wonder if you could share a bit more about the machine learning algorithm, such as the model creation. That means he want to know, or he or she want to know more about the algorithm that you have developed.
Okay, thank you for the question. Actually, I'm a medical doctor, so I'm not the AI expert myself, but I know only a bit of superficial information on the AI. But we have our AI team to really develop the system. But what actually we do, we have set of data. When we split the data into the training and the data to develop and to train the model. So initially we have about 350 to 400 data, and then we split into two. Half we use for data development, the model development and the training, and then we try to some validation during using the other half, and also we do like bootstrapping for more internal validation. In terms of the algorithm that we use, so like I mentioned before, I think after looking at the nature of the data, so we select a few algorithm that might be suitable to our data. So I think we use logistic regression model, random forest model, and the one class SVM model. So, and then we also run a number of in terms of different day of presentation of the symptom with that model, and then after run a few, and then we select the best model with the good accuracy. But the system is actually developed by our AI team lah, not my team. Yeah.
AI team. Hello.
Yeah.
So you want to add anything from the AI team here? You or Dr. Ng?
AI team is actually from the computer science. We are all the medical doctors here.
Okay.
The few of us. Yeah.
Okay, sure. Okay. Maybe okay. So we move to our next questions. From Prof. Noran. He say very awesome presentations, yeah. By 3 panels. Love the idea of gamifications in dengue literacy. How do you sustain motivation over time among the user? That how did you design and include a fun and rewarding issue in your projects? That means basically Prof. Noran asked, how can we motivate the user all the time? Like you say, the Candy Crush. Every day people are trying to play with that things for few, maybe 1 hour, what, right? Okay. So what is the motivation behind the game that you have developed, Dr. Teo?
Thanks for the question, Prof. Noran. So I think back to why is it like look like this now, the app, okay? So we have considered quite a lot. We did a review of multiple gamified health apps. And then since we need to cater to a broad group of users, okay, even old people, so we have decided to go back the quiz mode because the old people don't like the cartoon and game kind of thing too much lah. So this one we try to strike a balance in between. Okay, so you asked about sustained motivation, right? So far, I think this app has content for about, I think it can be finished in 2 hours. I think lah, maybe 3 max. Okay, but again, we are evaluating it. We are hoping to see lah, people who have downloaded the app. How many is the completion rate of the 100? I haven't got the data yet, lah, Prof. Noran. If everyone complete it, that would be fantastic. Means the gamification works, lah. But if not, we'll have to add in more gamification element, lah. So far that you can see, it's just a badges, and then got a trophy at the end. Okay, and then there's this progress bar. So far, feedback from users, they say tak tahan lah, must finish the 100%. Want to redo to get 100% score. So at least I can hear from the people lah. The gamification actually push them to learn a bit more lah. Okay, over time, there's not much of time here because it's just 1 or 2 hours kind of module. We don't expect them to redo again and again. Once they learn it, 1 or 2 hours should be enough lah. But we haven't done a study to see knowledge retention. Even if they are good now, wow, I learned so much about dengue now, maybe they forget 2 months later. That one we haven't done anything to evaluate lah. So I cannot tell you much about that knowledge retention. Okay, design element, I think, of fun. So far, I think the gamification element that I told you, and we initially also try to do some voucher lah. We try to do some voucher. Whoever reach 100% gets some voucher. But then the team discuss, it won't be good for long term lah, because we do not have that mechanism after the project ends. Then what? Then the project, no one will use anymore the app. We don't know. So we try to do things that if it works now, it has to work in the future. Instead of give voucher now, stop 2 years later, then we don't know what's the effect going to be like. Okay, so yeah, I hope I answer your question from Nora.
Okay. Thank you. I think there are more innovative way, right? Okay, maybe 2.0, 3.0 games. Okay. So the question may be more motivating. Okay. On that matter, Prof. Awang, right, asking, great presentation for Ravza and the team. Have you explored data from the Malaysian Health Data Warehouse or My HDW? So maybe KKM have some data bank or database that you can explore and extract the data from there. Okay, Prof.
Okay, thank you, Prof. Awang, for the question. I think over the past few years, I have been trying to come up with the model to predict severe dengue. We try to look at many options or potential database that we can use to come up with the prediction. But the problem is, as I mentioned before, to predict severe dengue, there are many clinical and also maybe include lab factors that we have to include in when to make the prediction. If you look at the current database, the MOH database, their data is actually not detailed enough. The variable is not detailed enough for us to come up with a good prediction for severe dengue. But maybe that data can be used for other sort of prediction. For example, if you want to predict for patients who are going for admission, that possibly can be used. But for predicting inpatient dengue, the variable is not enough. So that's why our team, the first step we do, actually we come up with the electronic form for the development of the database, so automated database. So we collect all the variable, include all the clinical lab information, so all the detailed information that required to give a good prediction for a severe dengue. But of course, I think that's a good suggestion for other teams, you know, especially those in the primary care. If you want to use in terms of other prediction, maybe we can look at the Malaysian database in the future. Yeah, thank you for the question.
Okay, thank you for the answer. So another follow-up question from Adina. she is asking Dr. Ng, what behavior change strategy can be used to encourage and empower patients to do more self-monitoring? So that's maybe Dr. Teo, I think. Dr. Ng, sorry. Dr. Ng, sorry.
Yeah, thank you for the question, but Chin Hai, you're always welcome to answer and add in. All right. I'll think of this in the context of me as a family doctor, as a primary care doctor, seeing a patient in the clinic, and we are trying to encourage and empower them to do more self-monitoring. I think there's a few things that we can consider, but to begin with, a specific goal setting, we always talk about the SMART criteria, something specific, okay, I need you to monitor at what time of the day, all right, okay, so that is something that really achievable and it is within the time base, okay, and of course we must provide them with a self-monitoring tool, and in this case we are hoping that our dengue app will be the easy to use self-monitoring tool that will help them in this self-monitoring behavior, okay. Education and awareness, of course, so that they will know what is the benefit of self-monitoring, okay, what is the importance of early detection of these warning signs, warning symptoms, and what are the potential risks if you neglect all these warning symptoms to begin with. I mean, when they're aware of the consequences and the importances of this self-monitoring, and I'm sure that will have their impact on their behavior, okay. And of course, this may be related to Chin Hai. I borrowed a point from Chin Hai's gamification as well. It will be good to always consider some form of incentive and rewards, right? Okay, for these self-monitoring behaviors, and it may not necessarily in monetary values. Okay, it can be things like access to special services. Okay, a feedback from doctors on their data or their self-monitoring data. Okay, we find that from our interview, patients do appreciate that tailor-made feedback to what they are keying in their symptoms. Okay, of course, whether we can achieve this or not, it really will consume a lot of resources. But at the moment, these are some of the things that I can think of. Okay, I hope I answer your question in some way.
If I can add just a bit, I think Violet has
Yes,
said
please.
most of the thing, but many times when I was doing previous studies, how patients decide in terms of behavior change, what will motivate them to do something. One of the things they trust a lot is doctor's recommendation. If the doctor really spend 1 or 2 more minutes to really emphasize the importance of this, I think the patient, okay, Dr. Suroni, I better do. They have that kind of feeling. So sometimes doctors maybe are too busy, do not have time to emphasize on staff monitoring. Then they go back, they never do much lah. But if doctor really emphasize, I think that might change their behavior lah. Many times are reported in past studies overseas also. Doctor's recommendation
Agree.
very strong.
I agree also. If doctor asks, like, okay. Okay. Like they are the authorities on this matter, right? So we go to them, we consult them because they have to listen to what is their advice, right? Okay, that's the thing, basic thing, okay. I think maybe the medical doctor need to be convinced also in this matter. I see a follow-up question from Prof. Noran also. Dr. Ng, your tool is very useful, especially in a low resource setting. And what aspect of ethical consideration that should be taken into account? Ethical, Prof. Noran asking about ethical considerations.
Yeah.
Doctor.
Yeah, I think first and foremost, again, patient safety is something that I've mentioned before. That is actually of a prime consideration. But of course, another thing is when we talk about low resource setting, probably most applicable is they will be using some form of mobile technology to access our self-monitoring tool. I suppose data security and patient privacy is one of the potential risks that we have to be careful of. And whether we as the developer of the app and as a researcher, we have taken enough measures to really protect the data security and the patient privacy. I think this is also something that is always a concern that we read in the newspaper. Yeah.
To be short, that you have these what I call cyber security or security thing inside the app, is it? Something like that, Doctor?
Yeah, we try to take our measures. Of course, things like Chin Hai, please add on if there's anything I missed out. For example, of course, the server that we use, we make sure it's a secured server, all right, and we limit access to who has the patient's data, okay, even among the researcher teams. And I think one thing also is we try to limit what type of data that we are collecting. For example, in our data, do we need the full address of the patient, for example? Although we are interested in the location of the patient, whether it decides their behavior, whether they come to hospital or not, location is an important data. But do we want it to a specific address? Then probably not. So then we would refrain ourselves from collecting such identifying data. And also best practices, of course, we try our best to de-identify the data in our database so that the patient data is anonymized as much as possible. Hopefully in the future, we will be conducting some audit on our database, to see if there's any unauthorized access and also possible breach. And last and foremost, I think also, of course, patients should be informed that there's always this potential risk there, and there should be always an option to opt out from all this data collection. Okay.
Okay. I think, yeah, they're very detailed. Yeah. Dr. Teo, if anything, you want to add
No,
on?
it's just
No,
as simple as password. And we set it so that the password must have number, capital,
Okay.
combination of multiple words, just to reduce the chance of people knowing your password lah. Things like that. I think the programmer has like sort of basic things that they will use or set up the system, so should be okay.
There are no more questions here. Let me ask some questions. If you have to, can type in or unmute yourself. You can ask questions. For me here, they have a prediction about the what you call severe dengue. So how accurate is this? Is it like every number like 90% accurate? If I detect this patient who having this severe dengue, normally it's like 90% or 100% accurate. So any of these accuracy, Prof? Any these data that you have encountered or from your AI or AI predictions?
Yeah, like I mentioned in the presentation slide, so the basic model that we have at the moment have a diagnostic accuracy of about 84%, and it can be as high as 88%. And then, but this all go back to the data where we put it in. And like at the moment, the problem that we have is because the number of dengue cases is not many, and the number of severe dengue is also not many. So that's why that result in quite a low sensitivity for the model. But even with the limited number of data that we have, I think we produce already quite a good accuracy model, more than 80%. I think that is a potential that area that we can explore. It means that, if we can, maybe after this year we analyze again the data, we might have a much better diagnostic accuracy, which a better sensitivity and specificity. So I think for when we talk about model prediction, you can look in terms of why either you want to predict severe dengue, or you want just to discriminate who do you think are less likely to become less severe. So I think that's even small information is enough to help the clinician to decide how they can decide. Let's say you have like 100 patients in the ward, among these 100, who they should concentrate on, because they very limited resources to look at all the 100 patients, but maybe they say, okay, only this 20 patient is actually much high risk, or these 50 patients are less likely to become severe dengue. Doesn't mean that we're going to give a less care, but at least we have some alert system to know that which patient that we should maybe focus more on, so that we want to prevent them to become severe. So with the system that we develop, with automated data entry, as the times goes on, more data means much better accuracy model that we will produce. So if at the moment we only have about 84% accuracy, maybe by next year our diagnostic accuracy probably will increase much better.
Okay, Prof. This lead to my second question. Actually, basically, after this accuracy, like 84%, you can improve through, let's say, assume ideal condition to 100%. So that means the mortality of dengue can be removed, or what do you think? Let's say based on your AI prediction is already reached 95 or 100%.
Yeah.
So the statistic that you showed me just now, 100 people or 200 people or 300 people are pass away due to dengue will be zero. Is it possible?
The system to predict the patient at risk, there will be a patient at risk of becoming severe dengue. So the problem now, clinician have a difficulty to identify who are these patients. So that makes some of the patient deteriorate further. They didn't expect that, oh, this patient actually going to become worse in a short time. So because there's no system to tell, because of the complex nature of the illness. So if we have this system, this can actually help provide a support to decision to the clinician to decide whether this patient are going towards severe dengue or not. So if we be able to identify this, surely that actually will help to reduce the number of deaths due to dengue. But I cannot say that, okay, this system can surely will actually eliminate dengue deaths in a certain time, but surely I would say it will help the clinician to assist them in making decision on deciding which patient is actually at higher risk or at lower risk of developing severe dengue.
Yeah, that means yet to be seen the things like, but based on this, it's very what we call positive, convincing that by using this prediction or this gamification method, that the amount of mortality will be reduced significantly. Because at this moment we don't have any way to monitor or predict the severity, and then we let them go back or something like that. And as mentioned just now, the fever will, if not the fever problem, it's no fever, then you have a problem, right? That I mentioned just now. So hopefully by then we can really reduce the mortality rate of this dengue. So what if the about the use of this what we call apps, right? Beside this monitoring technology, do you think any other technologies, right, from your side that can be used to monitor? Any others efforts by other country or any other researcher to monitor or predict this kind of dengue beside this research that you are doing now? Any ideas, or this is the first in the? Can I say this is the first in the world?
Prediction. Yeah, I can answer for prediction. Okay, there are actually many models has been developed to predict severe dengue, but all this model development is only at the stage of research, and then with their limited data, but it's not been applied in the clinical, because the problem is all this prediction needs clinical data and continuous data. So I would say that the system that we develop is actually among the first that can say that we can actually have a system that can be applied at the clinical setting, because most of the model developed, they only say that, okay, we come out with a set of list of variable that can predict severe dengue with a data accuracy, diagnostic accuracy of a certain percent. Then that's it. No one can apply that in the clinical setting, because clinician, you cannot enter individual one variable. Let's say you say low platelet is the is one of the predictors. Comorbid is the predictors. Maybe high fever or presenting at day 5 is a predictor. So as a clinician, you are busy doing many things when you see a patient. You cannot manually enter that and then calculate what is the probability of this patient becoming severe dengue. But when you have a system that automatically predict for you using AI, machine learning, and the whole system, like a risk calculator that our team developed, That actually really helps a lot to the clinician. When they enter the information, as usual, that young patient like clocking patient, they enter all the information at the electronic form, automatically the system will calculate. So they don't have to enter or add any more rescoring as additional tasks. So once they enter, they automatically get the outcome. So that is, I would say, the unique of our project at the moment. Yeah.
Okay, so this is the uniqueness based on the discussion, it seemed to be a first in Malaysia and the world, right? That using the AI and really go into the clinical systems to predict the severity of these dengue. We have these 44 patients, participants, and then we have these from actually the participants also from government, also private clinics, right? If you have these what we call idea to collaborate with our team here, yeah, most welcome to contact them. Okay, so we have more of this data. I think when doing the discussions, if they can get more data and try in different area or different clinics, it will be a plus point for them. Okay, so far we have coming to the end of our sessions. I want to wrap up, okay, the public forum for today, right? So based on this very what you call interesting topic on dengue, it seems this is the way forward, okay? To use AI, games, and all this kind of software to counter the dengue, because we cannot eliminate the dengue, okay? So they have been living with us for, like I mentioned just now, past 50 years, okay? So we need to manage it. How we can manage this dengue virus? That's the better way, right, of tackling the dengue. Of course, one thing of the hygiene and the water and so on, have to remove this also for this dengue, the mosquito, right, that carry dengue. So I want to any last word or any bring home message, yeah? Start from Prof. Rafza. What is the bring home message for our participants here? And then
Okay.
followed by others.
Yeah, I mean, although we are talking about a patient who are already having dengue admitted at the hospital, but I think the main key preventive measure for dengue is actually back to our community, our own
Jangan ujung sangat,
individual,
ya.
prevention, taking care of your environment, you make sure that your environment is clean, there's no breeding site forming. So that actually the key aspect of preventing dengue at the first place. And then what we are project do, we are highlighting the application of technology and AI. So I mean, we are showing that how technology can help a medical field and improve a patient outcome in the end. Yeah.
Okay, Dr. Dio,
Yeah,
bring home
so
message.
just same like Prof. Raza, I think prevention is key, but our project are mainly like self-care, clinic when you got disease already in the hospital. We did not do much of the prevention work here, but it's still the key lah. Okay, to even totally avoid dengue at all. Okay, so if let's say I think coming back to the gamification app lah. Okay, once it's ready, I hope everyone here can try it out lah. Okay, maybe I'll contact Dr. John, Miss Hayana to disseminate the app to all of you after our study finish lah, so that you guys can try it out also. Okay.
Okay, thank you. We are going to try, yes, this way. Dr. Ng.
Yeah, I think just building up on what they have to say is please do take care of yourself at home if you're infected by dengue, and don't delay any health seeking. Even though if you're unsure, just come and see a doctor. Don't wait until the next day, because that is also a prevention in its own right. Okay. All right, that's all I have to say. Thank you.
Thank you. Also, I want to take the opportunity to thank all these panel. They have done a great job, especially to complete these IIRG projects. And also thanks the organizer, MC, Miss Yana, for becoming this MC and also organize this public forums. I also want to thank Prof. Noran, okay, from the chair for this HWP, also organizing this public forum. Okay, I also get a reminder from our Miss Yana here. Remember to fill up the feedback form. She already posted in the chat box. Please give her the feedback so we can improve for our next public forum, because we are going to have regular public forums. This is our third series, second series. So we will have a third for another series of public forum. Again, thank you very much. If you have any other questions, please contact Prof. Raza, Dr. Teo, and Dr. Ng. Prof. Raza, you may type your email so that other people can email you, Dr. Ng and Dr. Teo as well, so they can have if they have any other questions or maybe collaborations opportunities. Because I see a lot of hospital and clinics joining this public forum, so they may have opportunities. We can expand further these projects. Okay, thank you very much for your time. See you again. Okay, bye-bye.
Thank you.
Thank you, everyone.
Bye. Thank you.